Good day and welcome everyone to Cochrane Canada Live. That is the research webinar series brought to you by the Canadian Cochrane Centre. My name is Adrienne Stevens. I hope you are having a great day. Before we get started, I just want to take a moment to thank the funding agencies of Cochrane Canada, those being the Canadian Institutes of Health Research, in particular their Knowledge Synthesis and Exchange branch, as well as to 7 of their research institutes. Thank you for your support during this funding period. And as well, I'd also like to extend a special thank you to the Pan American Health Organization. That is the regional office of the WHO for the Americas, to their Research Promotion and Development Division for their partnership in providing Illuminate Live to them. And so without further ado, I am pleased to introduce Dr. Carla Saenz, who joins us today from Washington, D.C. Carla holds a PhD in philosophy from the University of Texas at Austin. She undertook her postdoctoral work in the Department of Bioethics at the National Institutes of Health and continues to work with them as a guest researcher. She is a health research ethicist with the Ethics Review Committee Secretariat for the Pan American Health Organization, World Health Organization. PAHO Ethics Secretariat serves the function of ensuring that research with human subjects in which PAHO is involved meets ethical standards and is in accordance with basic ethical principles, is methodologically sound and beneficial for society, and is registered in PAHO's research registry. And so I ask you to please join me in welcoming Dr. Carla Saenz.
Good morning, everybody. Thanks, Adrienne, for the invitation to participate in this event, and thanks for your kind introduction. The topic of today's talk is what makes research with human subjects ethical. In order to answer this question, I think there's a prior question we need to work on, and that question is, what is research? So one of the main goals of this part of the talk is to clarify that research is different from medical treatment. What characterizes research is that its goal is the production of generalizable knowledge. That is, the objective of research is not to provide medical treatment to participants. Research is not meant to be therapeutic. It's not meant to guarantee benefits for participants in research. As a matter of fact, research might not benefit participants, and research might even prevent participants from getting individualized treatment. This is the case, for example, if you think of, say, a double-blind study. So, if what's going on is that in research we use people for the production of generalizable knowledge, then the question we need to ask is the following. Under which conditions is it ethically acceptable to use persons to produce generalizable knowledge? We all use each other in a number of ways. You're using me at this moment to learn some of the knowledge that I have, but you're using me in an ethically acceptable way. So we need to figure out, in the case of participation in research, what is it to use persons in an ethically acceptable way, for example, without involving exploitation. I think we all have a number of intuitions about this issue, and in order to get you started thinking about those intuitions that I'm sure you have, I want to introduce a case study for discussion. And it is the following. It's the Surfaxin study. So respiratory distress syndrome, I'll refer to it as RSD, is common among premature babies. RSD is caused by insufficient surfactant in the lungs. The treatment for RSD involves mechanic ventilation and surfactant replacement therapy. These treatments cost between $1,100 to $2,400 per child. So Surfaxin is a new surfactant. The plan is that it will be marketed in the US And based on previous lab studies and similarities with existing labs, there are very good reasons to think that surfaxin would work. So in order to see whether that's the case, the investigators studying surfaxin proposed the following study. It's a study that will take place in Peru, where surfactants aren't generally available. In Peru, neonatal mortality rate from RDS is 30%. So these researchers want to test surfaxin's efficacy, for which they propose a placebo-controlled trial. They want to study, include in the study, 650 premature newborns. All of them will receive ventilation, mechanic ventilation. 325, half of them, will receive surfaxin, and 325 of them, the other half, will receive just air. And as I said, treatment with surfactants is generally not available. It's as a rule not available for these children. And it's stipulated that the parents of these kids will consent for their participation in the study. So, having described briefly this vignette, I want to ask you the following question. Is this proposed study ethical? The possible answers are yes, no, I'm not sure. I'll give you a little bit of time for you to vote, and Adrienne will help me publishing the results of your poll. Okay, so thank you, Adrienne, for your help. None of you said the study is ethical. 16% of you said it's not ethical. 33 of you, a third of you, said you're not sure, and 50% haven't voted yet. So I think we could guess that those of you who haven't voted are not sure about what the answer is. So I think it'd be fair to conclude that about 83% of you are not sure at this point whether this study is ethical or not. Okay, thank you, Adrienne, for your help. Let me now continue. My goal at this point is try to provide you some guidelines explaining on what basis can we decide whether a study like this or like any other involving human subjects is ethical or not. So there are three ethical principles to guide research with human subjects that were specified in the development report, which was elaborated by a specially appointed commission by the United States government after the discovery of the research scandal of Tuskegee. I'm happy to say more about Tuskegee in the Q&A section. These are the following principles. The first, respect for persons. The second is the principle of beneficence. And the third is the principle of justice. What do these principles stipulate? Respect for persons requires us to treat people as autonomous agents, that is, as people can decide for their own self, and to offer protection to those that have diminished autonomy, those that for some reason are not capacitated to make decisions for their own. I'm talking about children, persons who are mentally incapacitated, and so on. The principle of beneficence requires two things. First of all, do not harm, and second, maximize possible benefits and minimize possible harms. We often refer to those as risks. So maximize possible benefits and minimize risks. The third principle, the principle of justice, compels to treat persons fairly. As a rule, what that means is to treat people equally unless there is a morally relevant difference that would justify a differential treatment. So, having explained these three ethical principles, I want to go back to a question that we had a moment ago and ask you, what do these ethical principles require? And some of you might still be feeling a little bit paralyzed and might think that, well, now we know what the ethical principles are, but we still don't know what do these principles require. Now we're facing a particular case. So a common question is, well, how do we go from these principles that sound so general, so rich, as it were, how do we go from those principles to an actual research protocol? And this is a question that both investigators and members of research ethics committees ask themselves. So in order to answer that question and provide an answer to our general question of the day, what makes research with human subjects ethical, I want to introduce 7 more specific ethical requirements that are informed by the 3 ethical principles that I just presented, that have been developed by Zeke Emanuel, Dave Wendler, and Christine Grady in the article I'm quoting in the slide that was published in JAMA, and have been discussed in a series of subsequent publications. So these requirements, I'm referring them for simplification to avoid confusion as ethical requirements, are useful to guide our ethical analysis, and they do not constitute a different set of principles. I said that the same ethical principles inform these requirements, and I'll go back to this topic a little bit later. So what are these requirements that research needs to fulfill, research with human subjects needs to fulfill in order to be ethical? They're the following. I'm going to read them all, and I'm going to go over, I'm going to discuss them briefly one by one. Social value, scientific validity, fair selection of research subjects, favorable risk-benefit ratio, independent review, informed consent, and respect for enrolled subjects. The first ethical requirement, the requirement of social value, is the following. So in order for research to be ethically acceptable, it needs to be able to lead to improvements in health or well-being. So when we're analyzing whether a research proposal is ethical or not, the first question we need to ask ourselves is, can this proposal lead to any improvement in health or well-being? Can it generate knowledge? If the answer is no, then the research will lack social value and will not possibly ethically acceptable. There's something I want to specify about this requirement. It's an important first requirement because no matter how minimal the risk is, research with human subjects always involves risk for the participants, and people should not be exposed to risks without any prospect of benefit. So if it's a study without social value, there's no prospect of benefit whatsoever. So it will not be ethical to expose people to any risk in this case. The second ethical requirement is the requirement of scientific validity. And here are the questions that we need to ask ourselves. Is the study methodologically rigorous and scientifically sound? Are the methods that are being proposed valid? Is the study feasible? Will it be possible to make inferences? The point is the following, similarly as in the case of the first requirement. Even research that asks socially valuable questions can be conducted poorly and then this lead to no benefit. So if study is going to be ethical, it will need to be scientifically valid. Because if not, no benefit, nothing good will come out of this research, and we'll be exposing participants to risks without any prospect of benefit. I'm going to cover requirement number 3 now, fair subject selection. Are participants in the research being selected or excluded based on scientific criteria, such as whether their participation will be answered a scientific question at stake? Is the minimization of risk being considered in the process of subject selection? Are the participants selected based on whether potential benefits can be maximized? Are the risks and potential benefits distributed fairly? Or, I mean, as you can imagine, there can be cases in which there's an unfair distribution of risks and benefits. For example, in the case in which one community bears the burden and the other in another totally different community and will enjoy the benefits. Having said that, I'll move to requirement number 4, favorable risk-benefit ratio. Can the risks to the individuals be minimized? If that's the case, then they should be minimized. Can the potential health-related benefits to individuals be enhanced? Do the potential benefits for society and individuals outweigh the risks? So if the study doesn't have a favorable risk-benefit ratio, then it will be not ethical. For the study to have a favorable risk-benefit ratio, then there will be the benefits for society and individuals should outweigh the risk. Now we're ready to move to the 5th ethical requirement, the requirement of independent ethics review. Is the study considered ethical by an independent committee? By independent, I mean, as it were, a third party, a group that is not involved in research. As you can imagine, the researchers themselves are in a conflict of interest situation, and they'll be inclined to say that their research is ethical. As an extra safeguard to protect participants in research, we want to make sure that a group that is not involved in the study agrees that the study is, as a matter of fact, ethical. With that, we go to the 6th requirement, one of the ones that attracts most attention, although it's not an exclusive guarantee that the study is ethical. I'm talking about the requirement of informed consent. Have the individuals been informed about the research? Have they understood the information? Have they provided their voluntary consent? If they haven't, then the study cannot possibly be ethical. Furthermore, have special provisions been taken for those persons that cannot provide consent for themselves because they're non-competent, their autonomy is compromised? So if participants have provided informed consent, either themselves or whoever is legally called to make decisions for them in the case that they're not able has provided consent for them, then the study can be ethical. Finally, the 7th requirement is the respect for enrolled subjects. So once we have participants enrolled in the study, there are a number of things that need to be guaranteed to ensure that the study is ethical. First of all, the privacy of the subjects should be protected. They should be given the right to withdraw from the study at any time without being penalized for doing so. They should be provided with new information, including the study results. And last but not least, their well-being should be monitored throughout the execution of the study. So these 7 requirements should be satisfied for research with human subjects to be ethical? As I said a moment ago, the same ethical principles that I introduced initially and that come from the Belmont report inform the 7 more specific requirements. The value, what I take is the value of having these 7 ethical requirements is that they're more specific and they're more useful to guide action from both researchers and and ethics committee members. So as you can see, the principles beneficence informs requirements such as social value, scientific validity, and favorable risk-benefit ratio. The principle of justice informs the fair subject selection requirement. The principle of respect informs the requirement of informed consent and respect for enrolled subjects redundantly. The independent review requirement is, as it were, a sort of procedural requirement that has and its point is to check that all the other requirements apply. So it's a requirement that's a matter of procedure, not a matter of substance, but it's still a requirement for research to be ethical. That is, research that has not been confirmed as ethical by an independent review is not considered ethical. Okay, so I have at this point explained these 7 requirements, and I want to go back to our Surfaxin study. So we're saying together again whether the Surfaxin study is ethical or not. So now we know one of my goals in this talk is to provide you with some tools to do the ethical analysis on your own. So now we know that the questions that we need to ask ourselves in order to answer the main question of whether the Surfaxin study is ethical or not is whether the Surfaxin study satisfies each of these 7 requirements that I've introduced to you. Does it have social value? Does it have scientific validity? Does it involve a fair subject selection? Does it have a favorable risk-benefit ratio? Does it have an independent review? How about informed consent? Does it entail respect for enrolled enrolled subjects? So I'll give you a few seconds to think about that, because I want to ask you again whether you think that the Surfaxin study is ethical or not. So, based on what on the application of these specific ethics requirements, I want to ask you, whether you think the Surfaxin study is ethical? Is your answer yes? Is your answer no? Or is it the case that you still don't know? And I'm going to wait a little bit for you guys to make your mind, and then Adrienne will help me again publishing the results of your vote. And please cast your vote using the A to C ABC letters that are on your screen. So this is what we have some at this point. Some of you think the study is ethical, and that's 8% of you. Again, 33% think that the study is non-ethical, and a smaller percentage now say that they still don't know, and we still have a rather high percentage of persons that haven't responded. That's 41%. I could say that 57 of you are still unsure about whether this study is ethical or not. You still don't know. And before continuing, I want to say that there's a high percentage of people that still don't know. It's by no means surprising, and it has to do with the nature of ethics analysis. I presented you with a case. I presented you with the requirements that need to be taken into account. But in order to see whether these specific requirements are satisfied in the study or not, plenty of reflection and deliberation is necessary, and training in research ethics requires developing the skills to apply these principles to particular cases, and it does take time. And even people with plenty of training, as it's usually the case with those that are part of research ethics community, take very long sessions deliberating on specific cases and trying to figure out whether the particular requirements apply, are satisfied or not. And I want to clarify that this reflection, deliberation, is extremely important. As I'll say later, there's nothing like an ethics algorithm. So now, I want to say the following about the Surfaxin study. In the way described in the vignette that I presented to you earlier, as it's described in that very brief vignette, the study doesn't seem to have social value, because it doesn't seem that it'll lead to any improvements in health or well-being. It seems to me to be what we call a Me Too study, to the extent that, well, the benefits that it's meant to lead to are benefits that we already enjoy. Those surfactants are already in the market, and nothing in the study says that the surfaxin will be any better than what we already have. So as described, it doesn't lead to any improvement in health or well-being of populations. Additionally, I said, when I described the study, I said that the study will be conducted in Peru, and that the product will be marketed in the U.S. That doesn't strike me as a fair subject selection, insofar as the benefits of the study are benefits that will be enjoyed by one group, say Group A, people in the United States, and the burdens of the study are being borne by a different group, the children in Peru, that seem to be unfairly targeted in the way the study is described. So as described in the vignette, it doesn't seem to me that the Surfaxin study is ethical. Again, as I said, this is just the very beginning of the discussion, and I'm taking some aspects of the vignette. I'm assuming, for example, I didn't say anything about it having independent review or not. Let's assume, for the sake of the discussion, that it did. At any rate, I hope this the case discussion helped you figuring out how to apply this ethical requirements to particular cases. I want to say a few things more about the requirements. There's something that I'm not sure you noticed about them, and it's that they're numbered from 1 to 7, and that order is not accidental. They're meant to guide step by step both investigators and the members of research ethics committees. And if you notice the order, they proceed, as it were, chronologically. So they start at the moment of the conception of a research study, and at the moment of the execution of the study. So when you start developing a research project, the first thing that you come up with is like, well, what's your goal? And that's where the requirement of social value is relevant. Then once you've clarified what your goal is, well, how are you going to proceed? What's your method? And then you go on to scientific validity. Who are going to be your research subjects? Fair subject selection, and so on. And we end not with informed consent, with the inclusion of the participants, but with the requirement to respect participants after they've been enrolled in the study, to do the monitoring that that the study requires in order to be ethical. So I think it's a virtue of the account that the requirements are organized in this way, and I think that this organization helps researchers to make sure that they're doing studies that are ethical, but it also helps research ethics committees. I've suggested several committees at this point to proceed this way. If you want to assess a protocol, one way to go to make sure that nothing falls through the cracks is to go one by one through these questions and start asking, is the study ethical? Does the study have social value? Does it have scientific validity? And so on and so on. So we organize our deliberation and our process of reflecting about whether the study is ethical or not. So we're getting towards the end of the presentation, and I want to present you with some take-home lessons. The first one is that research differs from medical treatment. So there are different ethical guidelines that should be considered in the case of research with human subjects. This clarification is, while it sounds as a minor, rather obvious thing, I think it's a key issue, and I'm just going to give you one example so you see how important it is. Many people decide to participate in research, say for example, study on some drug to see whether it helps reduce the size of tumors. Many people decide to participate in research because they think they're going to be treated for the condition that's under study. And if that's the case, if the persons think that they're getting treatment while, as a matter of fact, they're being used for the production of generalizable knowledge, then these people cannot possibly give informed consent. So it's very important for researchers to clarify throughout the study that that research is different from medical treatment. This is an issue that permeates a number of the requirements that I've talked about. The other take-home lesson, the second one I want to discuss, is the fact that ethics is not independent from science. It's happened to me several times that people have asked me to give my assessment about whether a study is ethical or not, and when I start asking questions about the science, I'm told something like, "Oh no, I'm sorry. We wanted to hear your opinion about ethics, not about science." So in that comment doesn't really make sense, because as you've learned today, in order to be ethical, research with human subjects needs to be scientifically valid. If the study is not scientifically valid, it cannot possibly produce any benefit for society, so we would be exposing people to risk without any prospect of benefit, and that is unethical. Finally, I want to clarify that there's no ethics algorithm. There's no simple recipe that can be applied as an equation to determine whether each case is ethical or not. And that's why training in research ethics and training in developing the skills to do ethics deliberation and ethical analysis is extremely important to protect participants in research. Certainly, I want it to be clear that there's one set of universal principles. Ethical principles are universal. Certainly as well, the application of ethical principles requires taking specific context and taking specific facts into account. And this is a property of ethics in general. It's not a particular issue of bioethics. Every time we apply an ethical principle, we need to take context into account. So the ethical principles I'm proposing are universal. However, that doesn't mean that in its application, specific context should not be taken into account. As a matter of fact, the application of any ethical principles requires taking specific facts into account. And as you might well imagine, there are relevant facts that differ. Facts about treatment access in Peru vary significantly from treatment access in Sweden. And all these particular aspects need to be taken into account. The final word about this is that that's why the work of research ethics committees is difficult, and that's why research that gets conducted internationally insists so much on the importance of having local ethics approval, because it's reasonable to presume that the local ethics committees will know better than anybody else the particular facts surrounding the research proposal and the specific context in which a research proposal will be developed. So unfortunately, no ethics algorithm, but universal guidelines, universal ethical principles that will guide our rich deliberation in ethics. Having said this, I want to thank you, and I have included a picture from Jane Dempster on research situation with human subjects in Guatemala. Just want to share with you, this is part of a project at PAHO led by the research promotion team to illustrate research with pictures. Thank you very much again. I look forward to listening to your comments and questions, and I'm gonna leave the mic in order to hear your questions. Thanks for the clapping.
And thank you, Carla, for that very wonderful and clear presentation. I especially the way that you wrap things up at the end with the take-home lessons. You've done a great job of making things clear. So yes, as one person has already started, please, if you'd like to ask a question and you wish to use your microphone, simply click the hand button that you see appear to the bottom left underneath the participant window. And we have Carmen Rosa who wishes to ask a question. Carmen, I'm going to release my audio. You can click your audio button, ask your question, and then I just ask that you also release your audio button, so just click that button again so that Carla can come back on and answer your question. Okay, Carmen, go ahead.
Good morning or good afternoon to everybody. Question about international situation, Carla. On an international situation, can the government of that country at an appropriate level, let's say Minister or Vice Minister of Health, be the one responsible for deciding if a research needs to be submitted to the local ERB or not? Or we will still be responsible? Thank you.
Thanks for your question, Carmen Rosa. I'm not sure I understood it very well. So you want to know who is responsible for when research gets conducted internationally, who is responsible for securing that it gets local IRB approval? Whether it's the investigators that are in another country, or whether it's the local Ministry of Health. Is that your question? Let me leave you the mic for a sec so you clarify it for me.
Correct. The thought will be that if we believe that local people, local entities have the local knowledge, then wouldn't that follow then that the Ministry of Health are the one responsible for deciding if something has to be submitted to an ERB or not? Thank you.
Thanks for the question. So research needs to have IRB approval if it is redundantly research and if it involves human subjects. And as simple as this sounds, it might be the case that it's not obvious whether something is research, where at PAHO, for example, are used to situations in which public health interventions, say, for example, epidemiological surveillance or any other public health intervention, involves a small research component. And it might not be easy to identify that the proposal does involve a little bit of research, right? So those are the two requirements that need to be satisfied for a proposal to need ethics approval. The arrangements can vary. I just don't think it's feasible for the Minister of Health to be the entity in charge of determining whether each particular research proposal would need ethical approval or not. And I think the investigators themselves that are part of the team should make sure that they're conducting research ethically. And in some countries, the situation varies dramatically. In some countries, the local government is more involved in making this the requirement of research ethics review operational. But regardless of the arrangements, it is the responsibility of those conducting research to get the research, to ensure that the research has ethics approval. In some countries, there is not even a centralized government-run research ethics committee. In some countries, for example, in Brazil, there is something like that. But it's by no means obvious that having a government-run centralized IRB run by the Minister of Health or a similar institution is necessarily better. As long as there is a competent, independent IRB review provided locally, the research is ethical. Thank you for the question, and I will leave the mic now for another question.
Okay, thank you, Carmen Rosa and Carla. So if any of you have questions, please feel free to either raise your hand at this time, or as I've noted in the chat room, you can also use the chat room if you prefer not to use your microphone, or if you're joining without a microphone. So why don't we just give everyone a moment here and just see if there are any further questions. And thank you once again for your participation in the polling to help guide the discussion that Carla led. Okay, so I believe that we are at the end of our session now. Thank you to all of you for joining. Carmen Rosa has one more question. Sure, no problem. I'll release my microphone so that you can come back on. Thank you.
I just wanted to hug the microphone. So if I understand you correctly, it seems like the only safe route will be to submit any research to local ERBs, even independently of whatever determination a U.S. ERB may have done. Correct?
Thanks again, Carmen Rosa. I didn't hear. The audio is not very well. So there's part of your question that I didn't understand. So you said that the safe route is to go get ethical local IRB approval independent of, and that's a little part that I missed. So I'll ask you to fill me in with that with the part that I missed again.
Assume that you have sent the project, the research to the ERB or AERB in the United States, independently of what that ERB may have said. Are we saying that the safe route or the only route is always to present it to local ERBs?
Thank you very much for the clarification. Now I understood your point perfectly. I had some acoustic problems earlier. Yes, research needs local ethics approval. So independently on whether, as you may know, for example, all the research in which there are funds by the U.S. government needs to be approved by the U.S. For example, all research in which PAHO participates, say providing funds or technical cooperation, needs PAHORIC approval. But still, in all cases, local ethics approval is needed. So if you're based, say, in Canada or the United States, and you're conducting a research project in, for example, Peru, my home country, you will still need ethics approval provided from an IRB in Peru. And there are very few countries now as far as I know, in Latin America and in the Caribbean, there are very, very few countries that don't have research ethics committees set and working now. And in those countries, if there is no research ethics committee, you will still need the permission of some of a local government institution to proceed and do research in the country. So local approval is absolutely necessary. So when Alina Farmanova is adding, this is, for example, a case of multi-center study, and even if it's not multi-center, I want to add, if it's a study funded by, for example, the U.S. government, gets conducted in Peru or in any other country, in Uganda, it would still need local approval from both Uganda and the United States. Alina continues and says, we had a case like that at Montfort Hospital. From what I remember, every site received local IRB approval. Exactly. As I said, local ethics approval is extremely important because the application of these ethical principles requires taking the particular context and the facts of the country into account. And as well-trained, as experienced as IRBs overall in here, for example, in the U.S. or in Canada or in the funding countries, we trust that the local IRBs have access to some information that might escape our attention and might be extremely relevant for the application of the principles. There's one more question, and I'll leave the mic to hear that one by Sarma.
Hello, Carla. Good afternoon. My name is Sarma. Congratulations for your brilliant presentation. As you mentioned, there is no algorithm for conducting ethical assessment on research. However, if you are going to apply those multi-centers internationally research, I mean a center in Europe, another center in North America, and another center in South America, would it be the best? Could you apply the Belmont report or the International Conference Harmonization, ESIC? Would it be the best in order to harmonize the ethical assessment of the research? Thank you.
Thanks, Irma. This is a very useful question for me to clarify an important issue, which is that the ethical principles are universal, right? So the principles in the Belmont report, I mean, I like to refer to Belmont report not because it was produced by the United States government or anything. I mean, the virtue of the Belmont report is that it articulated the three key ethical principles in a very nice and straightforward way. A number of efforts have been conducted lately and articulated as, for example, Helsinki, SIOMS, and etc., in order to specify what exactly those principles require. No one has attempted to come up with a new set of principles. It was just, well, these principles presented in the Belmont report they sound like too general. We need something that is a little bit better guiding action. So that goal is what motivated Zeke Emanuel, Dave Wendler, and Christine Grady when they articulated these 7 requirements. These 7 requirements are to be found, are perfectly consistent, and are, as a matter of fact, sufficient. They're perfectly consistent with all the international guidelines on research ethics. So if you apply the 7 requirements that I've provided, you've be covered according to any of the international documents. There's as I said, this work by Zeke Emanuel, David Wendler, and Christine Grady has been presented in a number of articles after the JAMA one that I mentioned, and in one of its recent versions in the textbook on clinical research ethics, published in 2008 by Oxford University Press, edited by them and a couple of others at NIH Department of Bioethics. In the article, in the version of the article that they have there, they address specifically the question you're dealing with, and they say, well, these are the regulations, and what we're trying to do is not to come up with yet another, long list, but to produce in the most user-friendly way 7 specific requirements that involve everything that has been said so far. Thanks, Sarma, again. Carmen Rosa had a question where I could address a bit more the definition of research. Yes, as I said, in order to decide what makes research with human subjects ethical, a key issue is defining what research is. So research is an enterprise aimed primarily at the production of generalizable knowledge. To that extent, it's fundamentally different from medical treatment or public health activities. When you go to the doctor, you go there to get treatment. You go there to get some benefit, right? And if it's called treatment, if it's called therapy, it's because we already know that it works, right? If we wouldn't know that it works, if we wouldn't know that it's beneficial, it wouldn't be called treatment. Unlike that scenario, when we participate in research, we're not getting treatment. Say I enroll in a research in which drug X is being studied, well, and I'll receive drug X for condition Y. Well, drug X is not beneficial to me because we do not know yet whether drug X works or not. If we would know that, then there would be no reason to do research on drug X. So we have to keep in mind that what characterizes research is that its goal is the production of knowledge. Its goal is not to provide therapy, provide benefits for participants. It'd be great if it does, but if something is being studied is because we do not know yet whether it works or not. Just happen to have here on my desk some quote from Einstein that that I found recently at the in the news in this magazine that you get when you're flying. I can't remember the name. Like the Sky Mall magazine. It's a plaque that says something that I find it incredibly fundamental. It's a quote by Einstein. He says, if we knew what we were doing, it wouldn't be called research. So if we would know already, going back to my example, the drug X works, it won't be called research. Research presupposes some genuine uncertainty about whether some drug or some intervention or some procedure is beneficial or not. So for it to be called research, we need that uncertainty about its outcome. Thank you, and I'm going to let you leave the mic for final question. If we have time for that, let Adrienne decide.
Okay, we do have one more question that's come through, so I'll repeat the question, then Carla, you can come back on to answer it. The question is, will we be able to get access to the slides of the presentation or access to recording of the session for future reference? And sorry, I hadn't read the question before I started chatting, so in fact, I can answer the question to that. Yes, at the end of this session, I will send through an evaluation form. I will also send you a PDF copy of the slides from the presentation. As well, we will also be posting the recording of the session on the Cochrane Canada website, and so feel free to access that. And you can also email us if you have any questions. What we can do is send an email to the group once the recording's been posted online. And I see that Raquel has a question, and that's no problem. This will be the last question of today. So Raquel, please go ahead and ask your question. So the question is, it seems as though there's somewhat of a loophole in terms of ethics approval, and no problem that you don't have a microphone. So Carla, go ahead and answer that question.
Thanks, Raquel. I'm not sure I understand, I quite understand what you mean by a loophole. Ethics approval is needed. Local ethics approval is indispensable. So we need to have approval provided from the country where the study is going to be conducted. On top of that, it's often a requirement by funding countries or funding institutions to have ethics approval by the funding institution or funding country. You added on an international scale. I guess what you might be suggesting is that, well, we'll need a number of, I can't remember who was giving that example. I think it was Carmen Rosa was saying, well, you know, we might be in a situation in which we need ethics approval from Europe and ethics approval from the US and ethics approval for, say, like 2 countries in Latin America. In that case, yes, we'll need ethics approval from all those parties. And that can be, researchers experience this often as time-consuming, but we have to keep in mind that the reasons why we're doing this to protect those who are participating in research, to protect those who we're using in order to produce generalizable knowledge from which all society will benefit. And I mean, if that requires extra work, well, extra work should be done. We have to err on the side of extreme caution. You say, for example, the example of Peru, if I'm a Canadian researcher wanting to conduct a study in Peru and I have funding from private donors, well, you will need to get IRB approval from Peru, and you will need to get, I mean, the majority, if you're a Canadian researcher, I bet you're affiliated with a Canadian institution that will require you to get ethics approval too. Depending on your private donors, they might take the approval by your Canadian institution as sufficient, or they might not. So it might well be the case that you get that in order to conduct the research that you're talking about, you will need 3 different ethics approval by 3 different committees. And having said that, I'm going to pass the mic to Adrienne. Thank you for this last question, Raquel.
Okay, thank you once again, Carla, for your wonderful presentation and the questions that you fielded, and I thank all of you for joining us for today's session. In just a moment, I will send through the evaluation form, and I do ask that you take the time to complete it. Please give us feedback on the sessions we provide, the use of Illuminate, and ideas for future webinar topics, and as well the PDF. And feel free to, as it shows on the screen, complete your evaluation form and email it back to us at ccnc-iph@uottawa.ca. And for reference, our website is ccc.cochrane.org. Thank you once again, and have a wonderful day.